Let's talk about the COVID-19 pandemic now. The head of the World Health Organization has recommended people cancel holiday gatherings as the Omicron COVID-19 variant continues to spread. Speaking at a news conference in Geneva, Dr. Tedros Adhanom Ghebreyesus said, an event cancelled is better than a life cancelled. All of us are sick of this pandemic. All of us want to spend time with friends and family. All of us want to get back to normal. The fastest way to do this is for all of us leaders and individuals to make the difficult decisions that must be made to protect ourselves and others.
All of us are sick of this pandemic. All of us want to spend time with friends and family. All of us want to get back to normal. The fastest way to do this is for all of us, leaders and individuals, to make the difficult decisions that must be made to protect ourselves and others. In some cases, that will mean cancelling or delaying events, just as we have had to cancel the reception we plan to have with you today. But an event cancelled is better than a life cancelled. It's better to cancel now and celebrate later than to celebrate now and grieve later.
Professor Gordon Awandare is Director of West African Center for Cell Biology of Infectious Pathogens. He joins us shortly on Zoom for a conversation. Prof. Awandare, I'm grateful for your time. What do you think? Should Ghana heed to the advice of WHO and cancel Christmas, or should we celebrate Christmas in moderation?
Good evening, Aisha. Yes, I think that we need to moderate. I know that it will be not realistic for us to say that we're canceling everything, but I think we need to moderate. We need to scale back. I know that a few weeks ago, things were looking much different. But since the Omicron variant came around, we see that the cases are picking up. So we need to make adjustments. We need to scale back events, probably change venues for others, and put in measures to minimize the risk. So I have already suggested that we should put in place, the options for people to test before getting into the events. We have rapid antigen tests that we can now deploy. So we need to do that and let people pay for these tests before they can go to these events. Because it's very important that we try to minimize the height of the wave that is coming.
Let's understand the situation in which we are now, how dangerous it is.
Well, if you look at what happened in the third wave, it tells you that this wave can also be as bad as the third wave, and we can lose a number of lives. And also, even what is more likely is the pressure that it will put on our health care facilities and the healthcare personnel. And whenever you have that much pressure on the health system, you lose lives not only to COVID, but you also lose lives to other diseases that could have been better managed. And so diseases that or deaths that could have been prevented if the system was not under pressure, those deaths may occur because of pressure on the health facilities and on the doctors.
So we know that there are a number of events lined up. People have planned how to celebrate their Christmas. There are so many activities that will be ongoing. What do you advise that people do? They've already planned these activities already.
Well, that's why I advise that we scale back and then we put in measures to minimize the spread. So we have to encourage vaccination. I know that the government has put out a mandate or proposed a mandate to require people to be vaccinated before they can go to these events. We need to do whatever is possible legally to make sure that that is enforceable. Then we need to really make the vaccines easily accessible. We need to have vaccines everywhere. I know some countries have done vaccination over 24-hour periods. So, they just set up and for 24 hours are open for vaccination. People can go at whatever time is convenient for them. So we need to think about some of these measures. We need to be vaccinating every day, including Christmas Day. We need to make sure that vaccines are available every day. And then I think the Ghanaian people, we need to just appeal to the Ghanaian people that we didn't have vaccines before, and we were all complaining that the government had not secured sufficient vaccines. Now we have a good quantity of vaccines in the country. Let's use the vaccines that we have. Let's not, allow this wave to cause as much harm as the third wave did. We have the opportunity to minimize the impact of this wave if we vaccinate. If the vaccination coverage goes up significantly, it means that hospitalizations would be minimized, which means that the pressure on the health system will be less than before, or would be minimized, and which means that we will save more lives, and we can recover faster from the fourth wave than we did from the third wave.
Professor Awindari, I'm grateful for your time this evening. He is the director for WACBIP at the University of Ghana.